Welcome. This is a conference call with patients at Coalinga State Hospital. The date is May 2nd, 2020, and I am the moderator, Jeff Gambord. We are now recording. This conference is specifically to update a conference which took place 7 days ago on April 25th, 2020, with the Associated Press reporters Robin McDowell and Mike Resendez, which is posted on StephanieClendenin.com. That's StephanieClendenin.com for review or download. Today's conference will specifically the subject. Now I actually got my notes messed up here. The subject matter is specific to the Department of State Hospital's mismanagement of COVID-19 issues related to staff not wearing a mask consistently in accordance with an internal email of April 10th, 2020. The essence of that email stated that all masks must be worn by staff in patient care areas or when working in close proximity to others. Now, I understand that the email did not specifically give a distance, but I was told by Brandon Price that they're following CDC guidelines, which we can presume is 6 feet or anything under 6 feet. So I am citing specific languages, which is proximity to others. This week, a new issue arose with issuing of masks to patients at Coalinga State Hospital. As with all things we are familiar with going back many years, this program is fraught with flaws, inconsistency, lack of communication, angry patients, and even the possibility of transmitting COVID-19 if the staff distributing patients' masks are not wearing masks themselves. And we have a patient at the very end who will be making a presentation on that. We should have approximately 10 patients on the conference who will be making 2-minute presentations about the observations on their units the past 7 days. They are using 4-digit codes because they fear retaliation, except our first presenter, Sam, who is on a hunger strike. Their identities will be emailed to the Associated Press after this call or any reputable entity wishing to investigate their claims or interview them individually. These men are here to express concern for our essential care providers and their peers. None of us want to see our staff or peers get sick. Ultimately, the responsibility for mismanagement of the COVID-19 crisis falls upon the Director of State Hospitals, the Director of Coalinga, the Chief of Law Enforcement, and those in the legislature who are ignoring this crisis. I want to emphasize and make clear that all of these individuals were invited to the conference call on April 25th, and they were all invited to the conference call today, and they declined to participate. Gentlemen, let's begin. Please watch your clocks and stick to 2 minutes, and please try not to talk over others. Sam, you'll be our first presenter. Would you please go ahead?
Okay, this is Sam at Coalinga State Hospital. I'm present for this conference call today, despite numerous threats I've received from staff following the previous conference call on 4/25/20. I will not allow any threats by staff to deter me in any way. As to the issue of staff following the DSH policy email of 4/10/20 for all staff to wear face masks while at work around patients at all times, well, I did see some slight improvement on the part of site techs and hospital police since our last recorded conference on 4/25/2020. It really saddens me to report that Unit 6 staff and the whole mall area, as far as are far from full compliance with the DSH policy email of 4/10/20. The staff here must be ordered to take this more seriously or sent home without pay if they are caught without their face masks on. We will never safe from COVID-19 until the administration here at DSH-Coalinga decides to crack down on their staff and compel 100% compliance. This is day 17 of my hunger strike without food or meds, despite my poor heart condition and constant chest pains, which is now extended to my left arm. I will never end this protest until I'm returned to where I was on 4/16/2020 at 9 a.m. This administration has clearly violated my civil rights by moving me on that date and placing my life in grave danger during this awful pandemic. I may not make it much longer with my poor health, but when you feel your life is in grave danger, you fight as long as you can. I could never have lasted this long without some sort of divine intervention. Finally, staff on Unit 6 are taking levels if we do not turn in our face mask daily. That is not what the memo states. Thank you very much, guys.
Okay, Sam, I want to clarify one thing. You're on a 1-to-1, correct, on your hunger strike?
That's correct.
And the staff have been observing you to confirm that you're not eating food, correct?
That's correct.
And you're on day number 18, is that what you said?
That day 17 today.
17, okay. Thank you very much. Patient number 26, you got a low battery, so why don't you go next?
Yeah, all right. I'm going to give mine and I'll be gone then. So my unit's basically the same. It seems like the masks are optional for the staff. I just went and checked before I came onto the phone. There's 2 staff that are out in the day room without masks. So, like I said before, the staff, the nursing staff for the most part seems to wear it, but the psych techs seem to be using it as an optional thing. Difficulty breathing through them they complain about, or that they're making their face break out. So I guess their skin is more important than our health. And that's pretty much my response.
What's the consensus on your unit in terms of wearing the masks? Are patients having an aversion to wearing them?
Some are wearing and some are not. Some are choosing to wear them, and they're saying, the people that are wearing them are saying, well, we're wearing them for the other people, not for ourselves, which is the theory for those people. The other people just say, I'm not going to wear them because we don't have any infection going around. They're not the staff aren't going around wiping down the doors like they did when we had influenza, so why should they be wearing a mask is the comment.
Okay, is your unit making you turn them in, or what's the deal with that?
Yeah, they come around 9 o'clock at night and exchanging them out. It's optional, though, but they're not taking levels.
They're not taking levels. Okay, thank you very much, 2626.
Okay, bye.
1954, would you please give a report on your unit, on what you've observed in the past 7 days, and what's the issue with the masks?
All right, the first day, this is 1954. The first day, everybody had a mask on, in other words, Sunday. And I know that they lowered them to talk to each other inside the nurses' station, but out here on the floor, everybody had a mask and they all wore them. After that, it's rare. Hardly anybody's wearing a mask. If they have a mask, it's under their chin. And as far as the patients getting their masks, it depends on what staff is working. Some staff don't care if you want a new mask, you have to trade one for one. If you want to keep the one you have and launder it, you can. Other staff insist that you turn it in, and the hours are 7:30 till 9 p.m., that you can turn them in and get another mask. I brought up to them that our name is supposed to be inside. There's supposed to be 3 masks for each patient. Our name is supposed to be inside, so we're not breathing out of somebody else's mask every other day, and that they're supposed to be laundered according to these CDC, the Center for Disease Control guidelines. Okay, and the last thing, and of course they listen to me, but what are they going to do? They're just staff. We only have 3 staff on this unit. That's it. So, and the last thing I want to say is that people are going back and forth, staff are going back and forth between units. This is HIMD, this is the psychologist, and so forth. They'll work on 11 and come across to 12. And so that is spreading taking a chance of spreading whatever germs they got in that way by not having the PPE and by not like changing gloves when they push the carts out to hand out the trays, stuff like that. So they're not complying, and that's pretty much going to be the way it is around here because there's only 3 staff. Thank you.
So to clarify, in the last 7 days, you've seen a majority of your staff wearing their face mask below their chin and that sort of thing?
Yeah, every day except Sunday, a week ago.
Okay.
Everybody had their masks on perfect. Since then, it has been rare.
Okay. All right. Do we have 4444? Have you come on yet?
Yes, I'm here.
Okay. You want to give a report on your unit, sir?
Yes.
First talk about the staff wearing the mask, and then talk about the patients.
Okay, the staff in the nursing station, for the most part, the site techs, they really don't wear their mask inside the bubble, and it's hit and miss outside of the med room. Sometimes they wear it, sometimes they don't. Just now, I seen a nurse come down the hallway, and he didn't have his mask on. Most of the nurses wear theirs. But for the most part, with the site techs, it's hit and miss if they wear it outside of the med room. When it comes to the patients, there are a handful of patients wear their mask. I've listened to the patients talk about wearing their masks. The patients say that they'll wear their mask off the unit, but on the unit they're saying that they don't want to wear their masks. I haven't heard too much about the site techs talking about picking up the mask at night. The rumor is that they're saying that they're supposed to be picking them up at night, but I haven't seen them come around and pick them up yet. So I don't know what they're going to do. We just got them, yesterday as it is.
Yeah.
So they haven't implemented too much yet.
One of the things we're going to talk about real briefly at the end of the call is the concern about transmission of COVID-19 with these masks. And one of our last presenters will be speaking to this is if the staff aren't wearing masks and they're handling the mask, and there's some concern about whether the masks themselves could be used to transmit the coronavirus. So you guys hang in there with us till we get through our presenters, and we're going to talk briefly about that at the end of the call. What are they doing on your unit 4444 in terms of, are they forcing you to turn in the mask or threatening you with levels or taking your levels or anything like that?
They haven't done that yet, but it could happen. Because that's what the rumor is that they are going to be picking them up at night, and if we don't turn them in, we could get our levels taken. But it hasn't happened yet. Are you guys
concerned about wearing a mask that somebody else has worn?
Yes, it is a very big concern.
Okay. Let's say that till the end of everybody's presentation.
All right.
Let's 1023. Are you on the call? 1023. Have you come in yet? We don't have him on the call. 3144. Are you on the call? 3144. 3877. 3877. We don't have 1234. 1234. Let's go with 7335.
I'm still here, or I'm here.
Go ahead.
I have several things to report.
Can you? Your volume's a little low. Could you please bring up your audio?
I can't bring it up anymore.
Can you talk a little louder or come closer to the phone?
I am within 1 inch of the mouthpiece.
Okay, if you just talk a little louder. Thank you.
We just have lousy phones here. As far as psych techs go, the staff, the LOC staff, has pretty well been using the mask. However, the hospital police have not, especially when they're in their office, nurse's station. They sit shoulder to shoulder, and rarely, if ever, have a mask on, and quite often don't even have it on their body at all. It's totally gone. I talked to one staff last week who said they've been measured for N95 masks every year, but they have, every time they ask for it, they are told there aren't any N95 masks, even though they've been promised that they would get them. I think that's about it.
There was an issue you had told me earlier about the teams, taking your team if you don't turn it in, I think.
Oh, yes. Thank you for reminding me. We have been given masks, and we're told that we must turn them in every night between 7 and 10 p.m. on a 1-for-1. If we do not turn them in for 3 days or on 3 different occasions, we will be taken to team. So we will be punished if we did not turn them in. They promised that those masks would be laundered according to CDC guidelines.
What do you think?
The unit supervisor also said that there is no COVID-19 currently in the hospital, I challenge her saying, unless people have been tested, that's not true. And I challenged her and asked her if she was tested, or she refused to answer. So my guess is that there's been no testing in the hospital at all, even of the staff.
Okay.
Until that happens, we cannot be guaranteed that there's no COVID-19 currently in the hospital.
Okay. 50-50, it looks like we're missing a couple people. Why don't you go ahead with your presentation and see if we get a couple people show up.
No one can hear me.
Okay, this is 50-50. One of the things I want to focus at is the admission into the hospital. If it's going to come in through the hospital, it's going to be coming through the staff that are coming in here. So that's where my focus is. I basically avoid dealing with the staff. So that's kind of where my focus is. They seem to have gotten a little bit better about when they're around with the patients, but there's still the problem. We have a large nurses station where they kind of observe. There's 3 computers there that they're on.
We're getting a lot of background. If anybody's, we'll get a lot of background. We're recording this. If you guys could please mute your phones if you're not speaking, appreciate it. Go ahead, 50-50.
Okay. So the psych techs, and it's mostly the psych techs, you have some of the other ones that do it their own, but the psych techs are the ones that are there in the room. They'll have 6 people in the room for socializing and with that, and they crowd over to one side of the room. So they're definitely not within 5 feet of they're definitely within 5 feet of each other. Sometimes it's a matter of inches or less than a foot. They seem to crowd around dealing with the computers, watching whatever the other person's doing, and so they're a person right behind them, or right to their side. They're not practicing the social distancing. The other thing that I brought up last week, which still happens, is, like, for instance, last night when I was on the phone with Jeff, only 1 staff member out of 5 that was in the nurses station had a mask on. They're taking the mask off. When they pull the mask down, their fingers are going inside, so they're getting their saliva on their fingers when they touch the doorknob, when they touch the keyboard, when they touch the mouse, and I don't see them wiping down very often behind it. So what I understand is they're not supposed to force us to turn in the mask. You need to look at the place where everything's coming from one place. So they came around and collected the mask at 8 p.m. We're supposed to have another mask because it was supposed to be a 1-for-1 exchange. They're not. They're just taking the mask. So it's sending. I'd rather clean my own mask personally, because that way it's not touching somebody. Even if the laundry and the record from the hospital, it's not happening, they're not taking the precautions when they're doing the laundry. I don't think they're using gloves. I don't think they're using masks. I don't think they're using anything. But even if they were, the unit staff passing out the mask are not wearing it. We get it from the gloves that they're wearing that they just touched the inside of their mask with. So that's where my concern is. That's spreading from unit to unit, the staffs that are floaters. It's what they're doing together, especially in that nurses station, that's going to spread it.
Do any of you other guys have, so has 1, 2, 3, 4 called in yet? Oh, yeah, hold on a second. Do any of you guys have comments about, I have another guy here.
Can you hear me?
Scott, are you ready to speak on the conference? Okay. Go ahead. Your number 7398. Go ahead and speak, Scott. I got you on the call.
Okay. Well, we got staff over here that want to put their masks on their forehead, there's one staff that ran around doing a count yesterday with no mask at all. When I said something to her, she looked at me like I was half-ass crazy.
Yeah, board.
The mask.
Watch your language, please. We're on a recorded conference call.
Okay, sorry.
Yeah, board, I'm on.
And then the mask that they provide everybody, there's one piece of like spandex material, and then the things that are like a surgical mask aren't even long enough to tie on your head. So you got to tie them in a knot and put them on your ears, which makes your ears kind of the abrasion of taking it on, taking it off. But they're saying that these masks are going to wash my greenback clothes. So now they're going to be taking that infection of whoever's mouth is on the mask and infecting the wash machine. And then I'm really concerned about whose mask am I going to put on my face next?
Right. And you now you mentioned to me yesterday that you saw a nurse doing count with her mask off. Can you talk?
That was Nevelyn. She's not a nurse. She's just psych tech.
Okay. All right. And you've seen staff in the offices with their mask off. Is that correct?
Most of the time, yes. They're in the, they take their mask and they put it down below, on their throat or whatever. And they, right now there's 3 staff in the office and none of them are wearing masks.
Okay.
They're not wearing them properly.
Okay.
There's a lot of staff that will wear the mask right below their nose.
Right.
Which is not the proper way to do it.
Right.
And I say something to them and they look at me like, well, I need to breathe. Okay.
All right. Well, listen, I had to patch you in, so I'm going to go ahead and let you go. I appreciate your contribution, 73.98.
All right, thank you.
All right, sir. Thank you.
All right.
Okay. So have we got 1, 2, 3, 4 on the call yet?
Yeah, I'm on.
Okay, would you go ahead and make a presentation first? Can you talk about what you've observed on your unit, and then talk about the mask? 2 minutes, please.
You want me to do what now? We broke up.
Yeah, first talk about what you've observed in the last 7 days in terms of the staff not wearing their mask properly, and then please talk about the passing out of masks and turning them in, that sort of thing.
Some of the staff are not wearing masks on the unit continuously. And one other issue that concerns me, too, on this unit is that when they pass out meds, they're not using gloves, which is a big concern. And also, they're making it mandatory to where we turn in our masks to where we shouldn't have to do it, because the board brought it to my attention, which I read the memorandum that says that they strongly recommend that you turn them in, but staff are actually telling us on the unit that if we don't turn in our mask, that you're not going to get one. So they're leaving us at risk. And some of the staff that are passing out the masks aren't wearing gloves or wearing masks at the same time. So it's a continuing issue. So it's kind of disruptive. And the other concern I have, too, is that I talked to another friend of mine, which he says that on the CDC website, it talks about what cloth the masks are supposed to be made out of, which is cotton. These are not cotton at all. They're like silk or spandex or something like that. Just cheaply made to make it look like that we're going to be safe, when in fact it's not the recommended material that they're supposed to be using. So they just don't give a damn as far as I'm concerned on this unit. By going around threatening patients and stuff that they're not going to get a mask and stuff, all they're doing is just making our situation worse to where we're actually high risk. At least I am. And there's a bunch of patients that are high risk, being diabetics, having heart issues, having a stent in their heart, like I got a stent in my heart and stuff.
And we have a lot of AIDS patients too here too, and people with heart conditions.
But it's making it frustrating though.
Yeah.
I mean, they make it so frustrating in here. It's just something so simple that we ask these people to do that they just don't want to do, because they run us. You know what I mean, these are kids in here that run this hospital who shouldn't even be running this hospital. So, but anyway,
I'm going to go through everybody one by one. If somebody wants to make a comment, let's give everybody 30 seconds. Sam, would you like to make a 30-second comment?
No, I mean, I agree with the previous statement about my friend.
Can anybody hear me?
Yeah, I'm going to go through everybody one by one and let everybody make a comment.
Had trouble.
Do we have somebody come in?
Yeah, me. 1023.
What's your number?
1023.
Oh, 1023. Hey, hold on, guys. We have somebody that just checked in that was missed, so let's give him make his call, and then I'll go back to everybody for a 30-second comment, so a group discussion. Let's hear from 1023, everybody. 1023, would you go ahead and make your presentation on your unit, what you've observed with the staff, and then about the masks, patient masks.
Yeah, this is Mike. I live on Unit 11, which is an unlicensed unit. It's a RU staffed by officers with minimal level of care, usually 2 to 3 staff level of care. what I've been observing is they have been, this week is far cry better than last week. The level of care I've been wearing there is the nurses have been pretty diligent about wearing their masks and gloves. Now, the officers is another story. Like the night officers, they wear their masks, but they take them down. They're sitting in close proximity of the computers. During the week, like this week, we've had Sergeant Sylvester, Sergeant Cardenas, Sergeant Polzine, and a lot of they gather here like it's a donut shop, and they none of them have masks on, and they're just piled in there, which is a concern. But we live on, like I say, our unit's a RU, so we don't really have that much interaction with the staff, and I keep my distance other than the med window or the food carts is the only time they're touching anything or anything. But I could say our level of care, which we have, like if you count them all, there's 7 of them that really rotate in, and they're all the same. They're pretty much they're our unit staff, and we get a few floaters here and there. One other concern I wanted to bring up that I thought was relevant to this issue, the fact that they've really dialed back the handy wipes. I don't know if anybody else on your unit, any other units, have noticed that they're not as accessible. The ones with the blue lid, the green Clorox ones have been kind of non-existent. I made a reference to one of the shift leads about why that is, and they say that they're down in program, and so we've been kind of delegated to the squeeze, the cell block 64 and the blue, which isn't going to kill anything. Cell block 64 will, but then you don't want it on the microwave and stuff like that. So that was a concern too. But overall, I'd say that the officers are the bigger issue on this unit as to our level of care. And this week was a lot better than it's been. I've noticed something must have triggered them to comply a little more this week than prior weeks. And that's probably
you're saying that the actual sergeants have been in the nursing station in close proximity to each other with no masks on?
Yeah, yesterday Polzine was in there. Sylvester's been here. He's here a lot at night, Sergeant Sylvester, and then Cardenas comes like in the mornings. Like I could say Cardenas had his mask on, but he's one. But and our usual offers, like the one that took us to the back today, he was compliant. He had it on, but it seems like once they're on the other side of that door, like the germs aren't there, and I think what it is the practices, they get lax. So they for the most part, you know what I'm saying, Gilmore, they go through the motions here. A lot of it's window dressing. They try to make it look like, okay, they're complying with CDC and the counties. And
one of the things that you didn't hear when I made, and we need to appreciate you bringing this out. And one of the things I want to say here, we're not snitching on these people. We're expressing concern for them because a lot of us care about a lot of these staff, and we don't want them to get sick, and we don't want them to make us sick, and they don't realize that. And I brought this out in the previous conference, that they don't realize that they don't know who they're sitting next to, where they went on their days off, or who they slept with, and they could be taking this home to their wife or their children. And we're doing this because we're expressing concern for them, and concern for our peers, and concern for ourselves. So we're not trying to throw them under the bus, or we want them to be safe, and we want them to be safe for us, and that's what this is all about. So when they hear this, and when they hear that we're reporting this, we're not trying to get them in trouble. We want them to be safe, man. So appreciate your report, buddy. So please stay on the line, because we'll have a little discussion here real quick. We want to try to kind of wrap this up in the near future, but I want to give everybody a chance to make a comment. So I'm going to go back through through everybody. Sam, and then go by your number. Sam, do you want to make a quick comment about what you've heard? Try to keep it about 30 seconds. Sam?
I think we need to do a follow-up next Saturday.
Oh, of course. But do you want to comment about anything you heard? Wrap-up comment?
No, this was very helpful. I appreciate everybody taking part in it. So.
Yeah. Absolutely. We definitely need to, we'll definitely do a follow-up. This will be reference number 2 on the playback number. We'll be posting this on StephanieClinton.com later today or tomorrow. And I will be calling Chief of Law Enforcement to see if we can tie things up around here. Let's go to 1954. Do you want to make a 30-second comment here?
Yeah, 2 things. I don't know if Sam's going to be alive next week for the call, but that's a lot of optimism, Sam. Good job. And the other thing is, we had a staff here that when we brought up about the temperatures being taken and all that, she rolled her eyes like, yeah, right, that's what they're doing. So I know for a fact that not everybody's getting their temperature taken when they come in, and they're just as lax out front as they are in here. And I know you told the reporters that you were aware that they were taking temperatures out in front, and I think you should let them know that that is not necessarily true.
I've never, I don't know if I mentioned that specifically to them.
Yeah, I remember, because that was one of the issues I was going to bring up. She rolled her eyes when we said to her, we appreciate that you're keeping as safe as you can, out in front taking blah, blah. And she rolled her eyes like, yeah, that's what's happening. So
who rolled their eyes?
I'm pretty,
Who rolled their eyes?
The staff member did.
Oh, okay. 44. Do you want to make a closing comment?
Yeah, I didn't mention the DPS officers. They a lot of them don't wear their masks. There are a couple of them that do, but for the most part, they aren't wearing their mask on this unit. It is a big concern up here. A lot of the guys are worried about the staff in general not wearing their masks. That's all I got to say.
Okay, 7355. Would you like to make a closing comment?
Yes, I would. Something occurred to me. We have a nurse practitioner who comes up here, of course, to examine us. She regularly walks between the units, and when I look at her, she's not wearing a mask either as she walks from unit to unit. Secondly, the sergeants who do come up here regularly do not wear a mask once they get into the office at all. So that's not an uncommon situation. Thanks for your time.
You're saying the sergeants don't wear a mask regularly?
Regularly.
Okay. All right. 1, 2, 3, 4. Do you want to make a closing comment?
Yeah, I kind of do. A friend of mine up here had his mom make some face masks out of cotton, and they were delivered up here in a package, and he actually refused for him to get the mask, the correct mask. And when I further talked to him, like I did you, Gamboard, about you contacting the CDC or going on the website and stuff, he definitely said if you go on the website, it lists the masks that are supposed to be made, and they're supposed to be cotton, not any other material but cotton to be effective.
Okay.
So that more research needs to be done on that. Right now, they just made these masks, is just try to relieve our stress and stuff like that, but these are inappropriate masks. These are not the correct masks to be given us.
Okay. Well, I'm not an expert on that, so I'll leave that to somebody else.
But it's on the website, though.
Right, okay.
Dude said it's on the website, so it's there.
Okay. 1023, final comment? Mike, 1023? 1023, last call? Okay, maybe he left.
Yeah, can I say one more thing?
Go ahead. Joe, 50-50, our legal expert. Closing comment.
Okay. On the last comment, number one is I can understand somewhat because it's not their industry. That would be DPS, which stands for Department of Police Services. I can see the janitors. I can see those that don't have that specific training. But what's a real embarrassment is the registered nurse and the psych techs, because that's their training that they should have had to know how to handle this. So they are specifically trained, and they pass their tests, which is how they got their license. That's an embarrassment, and I think it should be questioned as to should they still be in the medical field.
All right. Well, thank you very much, gentlemen. We're going to bring this to a close. Let's reconvene at the same time next Saturday to see how things are. Is that agreeable to everybody?
Jeff.
Yeah.
I've got to bail out.
Larry's got another comment.
7355 out.
Okay, go ahead, 7355. Go ahead, Larry.
I just wanted to back up, Mike, that Sylvester and those guys are up here without masks also on Unit 12, and it's usually late at night. And there's 5 of them in there chit-chatting. That's all I wanted to say, is to bring that up and verify what Unit 11 said.
So Unit 12 is seeing the sergeants up there without masks as well?
Yeah, they walk right across that little breezeway. Our units are right next to each other, and they all kick it in the office, and 5 of them, and chit-chat, no masks.
Do you want to identify them?
Well, I know Sergeant Sylvester because he's tall, but the rest of them, I don't know who they are. But I'll bet you they're the same guys that Unit 11 was talking about.
Okay. All right. Well, listen. Again, we're not trying to, throw them under the bus. We just want them to do the right thing, and that's what we're doing here. And it's all about safety. It's about keeping this virus out of the hospital. And I'm certainly not trying to get on their bad side here, and I don't think any one of us are. Correct?
Right. If they refuse to comply, we'll throw them under the bus.
All right, well, I'm not driving that bus. So, all right, you guys. So, listen, next Saturday, same time. Let's maybe get together a little sooner and remind everybody. We'll reconvene next Saturday at around maybe 10 to 2. And make sure we get everybody together. Thanks, guys. We're going to wrap this up. I'm going to stop the recording. See ya.
All right. Thank you.
All right.